come on in. Hi, Chanel. How are you today?
Good.
Okay. I want you to have a seat right here, please.
Okay.
Okay. Are you comfortable?
Yes.
Is the room's comfortable temperature for you?
Yes.
Okay. Hello. My name is Felicia Love, and I am a student at Winston-Salem State University in the RN to BSM program. This is a health assessment class, neurological examination, final exam. Okay. Today I have Chanel in front of me, and I'm asking Chanel a few questions. But before I get started, I did go ahead and wash my hands for universal precautions. I used some hot water and antimicrobial soap, and I'm going to go ahead and use some hand sanitizer right here in front of the patient, just to avoid any cross-contaminations and maintain universal precautions. Okay, Chanel, I am going to ask you a few questions. Can you please tell me your first and last name?
Chanel Carter Harris.
Can you tell me your date of birth, please?
June 13th, 1993.
Okay, can you tell me what year it is right now?
It is 2017.
Okay, can you tell me where you are?
In Charlotte, North Carolina.
Okay, so she is alert and oriented. Now I'm going to ask for permission to continue with this exam. Chanel, this neurological exam is for student purposes, and I also want to let you know that it is videotaped. It will be uploaded on YouTube for possible public viewing. Is that okay with you?
Yes.
Okay. Now, at any time during this exam, if I cause you any discomfort, any pain, can you please let me know?
Yes.
Okay, so we have permission to continue. I did go ahead, because of time constraints, I did get her a weight. It was at 157. Her height is 5 feet 7 inches tall, and I did go ahead and get her temperature at 98.4 degrees. Okay, at this time I am going to go ahead and get the other vitals from her, her measurements. I'm going to get her resting pulse and respirations, and I'm going to get her blood pressure. Okay, for 15 seconds, while she rests her arm on the table and breathes normally, I'm going to check her pulse. Okay, I'm going to check a radial pulse, starting, use my phone as a timer, starting now. Okay, so I'm actually getting 88 for a pulse, and I'm getting 16 for respirations. I'm going to go ahead and get blood pressure. Just continue to rest your arm on the table. I'm going to wipe my diaphragm off with an alcohol pad. I got 122 over 64, which is a good blood pressure. Chanel, at this time, I need for you to go ahead and sit on the end of the table, please. Excuse me. Okay, before I get started with the neurological exam, which is going to cover the 12 cranial nerves, I'm going to go ahead and ask you some history questions. Okay, now, have you had any headaches, frequent headaches, or anything about headaches
No.
you need to talk to me about? Okay. Now, have you had any nausea or
No.
vomiting? Have you had any dizziness or what they call vertigo?
No.
Have you or anybody in your family has a history of seizure activity?
No.
Okay, what about any tremors or shaking of your hands, feet, body?
No.
Okay, what about any weakness, not being able to grab things or having any weakness of your arms or
No.
legs? Okay, what about having any difficulty with coordination, being able to walk or stand still for
No.
a long period of time? What about any swallowing, any pain with swallowing, any difficulty swallowing liquids or solids?
No.
Okay, what about any problems with being able to say words and speak, or being able to be understood or get the words out?
No.
Okay, now have you or anybody in your family ever tested positive for encephalitis or for meningitis?
No.
What about any head injuries? Have you had any head injuries in the past or recent head injuries?
No.
Okay, what about any spinal cord injuries?
No.
Okay, any exposure or possibility of exposure from your job or anywhere to any type of chemicals?
No.
Okay, so now that was some history questions. If there's any other questions referring to you or your family with those same questions, are there any problems in any of those areas that you know of?
That I know of, no.
Okay, thank you very much. Now, so I'm going to start off with cranial nerve number 1, which is the olfactory, which is dealing with the sense of smelling. Chanel's going to face me, and I'm going to go ahead and close one of her ears. And I want her to sniff slowly. Now I want to do the other one. And that's just checking patency. Now she can also do an additional test where she's going to go ahead and smell some alcohol with her eyes closed. The second cranial nerve is the optic nerve, usually done by the ophthalmologist. They look at the Snellen chart and look at the letters and actually be able to count down to see where their visual acuity. But you can also do what they call a peripheral vision test, which is the visual confrontation, in which we will cover eyes, and then I will have her tell me when she sees a wiggling finger coming from her peripheral vision. Okay, that's number 1, and that's number 2. And I'm going to check her pupillary reaction. That's also testing her optic function. I'm going to bring in a light from side and then straight to the middle. I'm looking for her pupils to constrict. They're even and they're brisk at 3. So that's pupils are equal reactive to light. Now the next cranial nerve is 3 nerves together. It's actually the 3, 4, and 6. It's the oculomotor, it's the trochlea, and the abducens. And those 3 nerves actually work with the cranial, with the muscles of the eyes. So I'm going to do what they call the 6 cardinal gaze. I'm going to have her look straight at me without moving her head. I'm going to have her follow my finger just with her eye movement. Okay, so now I'm going to go into cranial nerve number 5. That is the trigeminal. That's dealing with the masseter muscles of the jawline. I'm going to touch her temporal line, and I want her to actually grit her teeth for me. Clench your teeth. Now I want you to move your jaw from side to side. Did you feel any pain or discomfort during that time?
No.
Okay, so now I'm going to go on to cranial nerve number 7, which is the facial. In the facial, I'm going to look for symmetry, which even, for her to smile. Now I want her to puff out her cheeks, and you can close them back. Okay, so now I'm going to go into cranial nerve number 8, which deals with hearing, the acoustic. Okay, I'm going to press on her tragus of her ear, and I'm going to whisper, and I want her to repeat after me. Apple. Blueberry. Okay, so now I'm going to go into cranial nerve number 9 and 10. Number 9 and 10 is the glossopharyngeal and the vagus. And that's also dealing with the mouth and tongue. So I have a tongue depressor. I'm going to have her open her mouth and stick out her tongue. I'm going to check her uvula as I press her tongue down with the tongue blade. And I'm going to shine the light back there. And I want her to say, ah. Ah. Okay, so ah. Ah. Okay, I'm looking for the soft palate. I'm looking for the uvula to be even and to be able to wiggle back. I'm also going to check her gag reflex. Okay, now number 11 actually deals with the spinal accessory motor. I'm going to have her, as she's sitting up nice and straight, I'm going to have her, with resistance of me pushing down, shrug her shoulders evenly. Okay, now I'm going to also have her turn her head towards my hand as I press against her jaw. Any pain or discomfort with either one of those?
No.
Okay, now the last one is number 12, and that's the hypoglossal, and that's also dealing with the tongue. I'm going to have her to stick out her tongue. I'm looking for it to come out evenly, and I'm not looking for any deviations to the left or the right, which could indicate some type of spinal injury. I also want her to say light, tight, dynamite.
Light, tight, dynamite.
So that I'm listening to her enunciation of those first letters. So Chanel, 24-year-old female. She walked in on her own without any assistive devices. Her gait looked very steady. She didn't have any problems with coordination when she stood on the scale. She did not complain of any difficulty, any past history of any problems. Her vital signs was within normal limits. I also did her pupillary reaction, and pupils were equal and reactive to light, and they were brisk in reaction. Also, we went over her history, and we also did we went over her history, and I also wanted to make sure that she realizes that if she has any problems in any of those areas, that she needs to go ahead and go to a doctor and make sure that she follow up with her yearly checkups to make sure that everything is okay. At this time, I just want to thank her for participating in this video and giving us permission, and thank you very much.
Thank you. Thank you very much.